2.
Hello. Hi, Edmonton. We are here for our very first Facebook Live event to talk about the new city plan and to try out something different for the city, which is to use social media for actual engagement, which is pretty neat. So bear with us today if we fumble or bumble a little bit. This is our first go at it. My name is Kalen Anderson, and I'm the director of the new city plan project. I'm going to be moderating some questions and answers from you over the course of the next hour, and also the three of us up here, who I'll introduce in a moment, will be in conversation with each other. So we do know that everybody has pretty busy lives and not everybody can come out to events, so this is why we're testing out an opportunity to use Facebook. Last week we tried Reddit, and that I think worked pretty well, answered a lot of questions and had a lot of engagement. So anyway, I'm pretty excited about this. But again, bear with us because it'll be a learning journey. So pretty excited to have two folks sitting with me today who are special Edmontonians. And if you don't know them yet, you'll get to know them here, and then you should definitely get to know them more after. Also in the background, we have a few folks. Charity's back there. She'll be helping with questions coming in through Facebook. So if I'm fumbling with that, you might hear from her. And yeah, what else would I say? Oh, there's a little, I do have some notes, so please excuse that. I'll try not to use them too much, but I need some prompts. And the one note that I would say is that we're just going to be dealing with questions today about the new city plan. So it's not an ask me anything about the city overall. It's really focused on our new city plan. And we will only be answering those that are respectful in nature. Although I don't think I need to say that, but I will. All right, so I'm going to get started and introduce who is sitting here with me today. So first, we have Dr. Karen Lee. Dr. Lee grew up in the Edmonton region and did her medical training at the University of Alberta. She has a Master's of Health Science and recently joined the U of A in the Division of Preventative Medicine. We welcome Karen back to Alberta after a decade and a half away in the United States, where she was working in the areas of chronic disease prevention. And specifically, she spent a lot of time during Mayor Bloomberg's administration in New York City working with that group. Dr. Lee and I have had the opportunity to discuss her work on disease prevention and what building a healthy city might look like in the past, and just seemed like this would be an awesome way to continue that conversation. So thank you very much.
Thanks, Kalen.
Yeah.
Happy to be here.
Great. And many of you will also probably know Mack Male. Mack is a dedicated city builder, a volunteer in our community, a storyteller, and a downtown resident. Mack was named both a top 40 under 40 by Avenue Edmonton magazine. I got that right. Avenue Edmonton. That sounded funny. And as one of Alberta's next 10 most influential people by Alberta Venture magazine. Mack started Taproot Publishing in 2016 as an avenue to tell quality stories about our community. And Mack has shared with me his passion for how we build our city, both physically and through community building and even governance and things like that keep us all ticking. So, and of course, welcome to all of you who are joining us today. Thank you so much for being here, for listening in, and then also for providing your questions. So before we get to those and start talking, I should probably just cover some basic territory, which is what is the city plan. So if you're joining us here to find out more about that, you should probably know what we're talking about here. So the best way to describe the city plan is that it's going to be a long-term vision for how Edmonton moves from 1 million people to 2 million people. So it'll be taking a look at our transportation systems, our green networks, our mobility, not our mobility, but our housing choices, where our jobs will be located, things like this. Basically, it'll take a look at everything that we need to do to plan our spaces and places as we double in our population, and the choices that we'll need to make to succeed along the way. So with that, I'm getting a note, so I'm going to read that note. hello to the City Hall School class from Rio Terrace. Hi there, City Hall School. That's pretty awesome. That's great. Sorry for bumbling a little bit. We'll get better at this. We'll get better as we start a conversation, I think. So we'll start with just us chatting a little bit, and hopefully as questions come in, we'll be able to kind of each take turns and provide our perspectives. There's really no right or wrong answer. We just want to get a conversation going about the city, building the city. So let's begin with kind of something big and broad and generic. If we're planning for a city of 2 million people, what kind of major changes do you think we will see or need to see in our community over that period of time?
Okay. Mack, do you want to start?
I can start, sure.
Great.
Thank you for having me. I'm a bit of a nerd about city stuff, so this is fun. Excited to talk about city plan. I mean, growing from 1 million to 2 million is going to be a big change. And the thing that I have in my head all the time when I'm thinking about this is what got us here is not going to get us there. So we're going to have to do things differently when we get to the next million people than we did for the first million. So I think there's a couple of key things for me personally that stand out. One of those is we need to grow up, not out. We can't sustainably continue to have the city grow out and out and out. So we're going to see greater density in Edmonton as we add another million people. And I think that's really going to change how the city looks and how we interact with the people in our city, right? I think that's a big change that's going to come. I think another thing that would be really interesting, especially as a bit of a tech guy, a geek here, is that we're sitting on a little bit of a gold mine in terms of artificial intelligence. We've got one of the top 3 centers in the world here in Edmonton. So I'd really like to see the city take advantage of that. And maybe we can become more predictive about things and less responsive. So not waiting until a resident has a complaint about something, but predicting where we might need to make a change, right? And because we're talking about city plan, I guess I have to mention the other thing that I harp on quite a bit, which is that we can be really good at planning, but we have to implement and we have to execute. So city plan I'm excited about. I know your team's going to do great work, Kalen, but we need to actually implement the things that you guys come up with and that Edmontonians come up with in the plan. So I think that's another big item for me.
Yeah. Well, I think, Kalen, it's such an opportunity when a city is growing and when it's planning for that growth to actually deal with a whole host of issues, right, that can improve quality of life for our residents, but also health and well-being. There's actually now a lot of evidence out there that how we plan and design our cities, our neighborhoods, our streets, and our buildings can have a tremendous impact on people's health. This isn't actually something that's new. Planning and public health actually grew up together in the 1800s, right? In the 1800s, our leading causes of death were infectious diseases. And we had epidemics of things like cholera, yellow fever, tuberculosis. And the way that we actually addressed those issues in the past was we created sanitation systems, right, in all of our cities. We created buildings that have windows that allow ventilation and light and air to flow through, right? We undertook things that would basically remove standing water so that mosquitoes that spread diseases like yellow fever would go away. Mm-hmm. And that was a major way in which we addressed the epidemics of the past, right? A lot of people think, oh, it must have been antibiotics, but actually antibiotics were not discovered until 1939, mm-hmm. and they were not in widespread use in, let's say, even 1940. And yet, if you look at the data from cities, you will see that infectious disease deaths had dropped tremendously, right, before mm-hmm. even the era of antibiotics. And that's because of the city planning work that we do. Well, today we've got a different set of epidemics. We know that we've got diabetes has been rising rapidly over the last 2 decades. Heart disease and strokes are leading causes of death, as are cancer deaths. And many of these diseases actually share the common risk factors of unhealthy diets, sedentary and inactive lifestyles, and also smoking. We've done a lot actually in many of our cities on smoking, but there's still a lot that we can do around planning and designing our cities to actually support people in being more active, in being less sedentary, and in being able to eat more healthily.
Yeah, that makes sense. It's interesting. I love that connection between built environments and health and thinking about that, because we might have, just as we solve, the wicked problem of cities and building cities is that whenever you seek to solve one problem, you might unintentionally cause 3 or 4 more. And so to separate uses that might have been in conflict with each other. We put everything in different spots in the city, but then that created environments where we're physically separated, and now we're dealing with the modern epidemics of whether it's diabetes, isolation, and mental health.
Yes,
it's very
absolutely,
interesting.
as
The
well.
knock-on effects of those earlier decisions.
Yeah.
Right?
Yeah.
So, I mean, I guess what would your advice be generally, both of you, in terms of, I mean, we know we can't be perfect at this. You know, we can't imagine every permutation and combination of the future, but there's got to be a way to be more adaptive in terms of solving today's problems, but realizing that we don't know what tomorrow's will be, right? Or that we might even unintentionally cause a few, whether it's through innovations in technology or new ways in which we're living together. Sorry, we're laughing. We're just going to wave.
Yeah.
There's the City Hall School Rio Terrace class is walking past and waving and filming us. This is really cute. That's great. I sort of lost my train of thought. That's really cute. I love it. It's really, really cool how the City Hall School is literally in City Hall, and they just pop up at any moment, whether it's in a committee meeting
That's great.
or here where we're doing a Facebook Live.
Very engaged Edmontonians.
That's true.
So
I don't know. I lost my train of thought for a second with the class, but I'm getting a prompt here. Physical infrastructure for growth. So we're thinking about how we need to build our city for 2 million people. Every time we build our city, I mean, it's not like something that happens once every 10 years. It's happening every moment of every day.
Yeah.
But how can we be more anticipatory of what we're going to need in the future? Or how do we react more appropriately when we realize things are going maybe not as we'd intended that they would?
Yeah. Well, I think it's true, Kalen, that, I think many of the unintended consequences were unintended. I mean, we didn't specifically design a city or our neighborhoods to necessarily promote sedentariness, but we were, enamored with new technologies like the car, et cetera, in the past, right? And as part of that, unintentionally built sedentary communities and neighborhoods and maybe streets that didn't accommodate all the choices that people want. But I think, as with any sort of successful organization or business, we have to change with the times, right? And we have to, if there are new issues that are arising, we now have to deal with those new issues. So you're right, in the past, we were planning for people to live away from industry because in an age of heavy industrial manufacturing, that made sense.
Right.
You didn't want to live next to the pollution or the runoffs, right? But today we live primarily in an economy that's service-based, right? And so when we actually separate people from those services, it's neither good for the health of the people, because otherwise they could actually walk there more easily, et cetera, and go there more frequently.
Choose other modes.
Choose other modes, including, bicycles and transit. And it's also good for business, because if people are near service-oriented businesses, then that's actually good for the health of the business, right? And so, and in fact, that's what we're seeing. In communities that are built for walkability, as an example, not only are they improving health through things like physical activity, but they are actually, for example, in New York, right? Whenever we put in bicycle infrastructure or transit infrastructure or walking infrastructure, we would evaluate the outcomes in those neighborhoods. And what we found was not only that walking or cycling increased, safety increased, not just for the pedestrians and cyclists, but for the motorists as well, right? Crime and stress can be actually affected, because if you have more people in the community, it can help to decrease isolation and increase the eyes on the street. And also, our our retail businesses actually tended to do better, right? And store vacancies in these areas also dropped. So there's actually so many co-benefits, right, that we know can be intentionally created, right? And of course, we have to also look out for the unintentional consequences as we do this.
Right.
And I think that's where data and engagement and some of those things are really, really critical, because we've learned a lot over the last number of years about how to build good cities, and we can adopt the things that they've done in other places and apply those to Edmonton. Bike lanes is a great example of that. There was discussion about bike lanes on 109th Street in Edmonton, and the business community was like, we want to have front door access to these cyclists that are going past our business. So you're right about those positive effects, but we need to be listening all the time, not just during the beginning of a project or at the set times and milestones along the way, but continuously listening to people in Edmonton to hear how these changes are impacting them and what they're seeing, what kinds of intelligence they can provide to city planners and the other people that are working to build this stuff out physically that could help make it better. And so I think that's an opportunity for us to improve on as we grow in the future.
I think it's also important that we're not thinking about, is it this versus this? Because I think what we're seeing, I think, in the research and in the evidence is that when we actually design and plan a city well, we can actually achieve multiple outcomes synergistically, like multiple co-benefits, right? So health and well-being, improvements in our environment and air pollution, but also, as I said, economic health of our communities and of our businesses, right? And I think also it's important for us, I think, when we're as community residents to also think about how do we accommodate as many choices as we can for as many people as possible, right? Because even if, like, for example, you're a driver and you're not that interested in taking the bike or in taking transit, the reality is if we provide those options and they're affordable, they're actually well run and well designed and they're safe, the reality is that some people who want to do that will do that. And then in that case, you'll have, less traffic to deal with if you're the driver. Right? And so I think that's one of the critical things. As we grow, we have to think, what will our streets look like if we don't have any other options other than the car, right? And New York City also was planning, when I was there, planning for the growth of its residents by 1 million people. And one of the things that it said was, we don't think it's a good idea to have more than 1 million new cars on the streets, right? So let's make sure that we actually provide other options so that those who want to use those options can, and then that's actually even better for everyone, including drivers.
Yeah, good segue. For those of you who are maybe just joining us, we're talking about the new city plan in Edmonton, and we do have a hashtag if you are interested in following that called Edmonton's Future Is. It looks like we have a couple questions that have come in, so I will take a look at our first one, and this is probably one that Mack might have some ability to help us with. This is from Jane on Facebook, and Jane's asking, what about tech infrastructure? Will the city plan deal with that? Tech. So I guess we can take that in a lot of different directions. But I would start off by saying, I know that last week, I think it was last week, forgive my memory here, it's either last week or the week before, we were at City Council with, or Committee of Council with several reports on emerging technologies regarding transit, or transportation, I shouldn't say transit. That was one of the aspects. But I imagine there are other domains in which we'll need to consider this as well. Yeah,
it's a great question. I think about tech a lot, obviously. The plan that went to committee last week was Smart Transportation Action Plan. Smart Transport, it's kind of like in your house. If you connect your toaster to the internet, then it's smart all of a sudden. So there's a little bit of buzz around this stuff, right? But, practical things like electric cars. In Edmonton, we're going to be doing an automated self-driving bus shuttle pilot here in November, which is really interesting. So how do we make sure that as we're planning for the future that we can incorporate things that aren't realistic yet, but that could be? What happens when we have self-driving cars? Maybe we don't all own a self-driving car, but there's a service that provides them, or there are self-driving buses that the city might provide as part of its transit service. We need less parking spaces. What do we do with the land that we currently devote to parking spaces? How do we make it easy for people to get on and off, in and out of these vehicles? Those are some really interesting things, I think, that will have a big impact as we're planning the physical space. The other part of tech that's really interesting in the context of the city plan, I think, is, what if we could gather a whole bunch more information about our city in real time, right? These sensors and things that are out in the environment that are giving us valuable information that the very smart people at the Center for Analytics Excellence and other places can make sense of and provide to planners and to politicians to be actionable insight on what we could do differently in the city. I think that sort of tech infrastructure that's hidden away is going to be really, really critical over the next number of years.
Well, I think there are ways to actually combine tech with things like our transportation systems in our buildings that can actually also help to remind people of some of the healthy things that they can do in everyday life. So I think we often think about, health information for behavior change. And the evidence shows us actually that health information might be good for increasing awareness, but if it's out of sight, it's actually out of mind. And so if you actually wanted to use health information to help people with behavior changes, often they need to be reminded right in their daily living environments.
They need a nudge, right?
And they need a nudge. That's
Yeah.
exactly right. So
Right.
for example, if you see a sign, right, at the elevator call area outside of a stairwell, just reminding you that you could take the stairs to help with healthy weights and to help with your health or to help with the environment because
Right.
it doesn't use electricity.
Right.
That actually increases stair use by over 50%.
Wow.
That's what the studies show. The simple things like that. So, for example, I know that some of our bus stops actually have things like when is the next bus coming, right? If it's coupled with information like take a 5-minute walk and get to the next bus stop, we could actually address multiple things at once. We could get people to take an extra little walk, particularly if the weather's nice. We could ask them to but even if the weather's not nice, right? Because if you're cold, that little walk
little
might
walk
actually
is
warm
good.
you up, right?
Right.
But it could also help to decrease, I think, our crowding in any one leg of the transportation trip, right? And so I think how we use information that is made technologically available, such as when is the next bus coming or when's the next train coming, where we locate it. So if that information is only inside the LRT station, then you're probably not going to leave again. But if it's also outside the LRT station and
Right.
it's combined with health prompting messages, as an example,
Right.
there might be ways for us to actually improve health and well-being, decrease sedentariness, but then also help with the amount of crowding that are on any particular leg of a transportation trip.
Yeah.
I love that idea. It made me think, actually, as you were talking, another bit of tech infrastructure we have in the city that I use all the time is the open city Wi-Fi. So there's free wireless access that the city runs at all of these places. And every time you log on to the device with your device, there's a screen on your device that asks you to agree to not do anything bad. What if that screen also said, oh, I know that you're in this location, here's some other contextually relevant information, or just a little nudge
Yeah.
to go out and take a walk, get some fresh air, stand up.
Completely,
Yeah.
completely. So
Lots
yeah,
of opportunities.
totally. But that tech has to be married, right, with the infrastructure that's actually there and those amenities
Yeah.
that are actually there, right?
Right.
Because if there's no transit, you can't do that.
Right.
If your stairwell is locked, you can't do that.
Right.
And so we do need to think about what our physical environments look like, but then couple it with the technologies that can help people to use that in the maximum ways possible for
Right.
health and benefits for the community.
Great. I think we'll move on to another question. This one is from Chris on Facebook. And Chris is saying, I don't think the high-level bridge will be able to handle the traffic load demands of a city with 2 million. Pretty much at capacity as it is during rush hour. A new southbound bridge leaving the downtown will definitely be necessary for our city's growth. How do we deal with transportation? It's a really good question. And that's a really old bridge. When you think about what that bridge was built for, it really wasn't constructed to haul commuter traffic as a major artery into our city. It was the connection point between two communities, Strathcona and Edmonton, which made the marriage of those two towns possible, which grew into our city, Edmonton. But it's our, well, I might get this wrong, but I feel like it's probably if not our oldest bridge within 2 or 3 years of being that. I'm not sure who takes the cake. Is it the high level or the low level? But yeah, fair point. So how are we going to get people back and forth, assuming that they're moving into the downtown and out from it and accessing that really important gateway into the University of Alberta, essentially, which is what that bridge provides. So this is a great question because it bridges kind of another topic, which is that if you just do a transportation plan on its own without considering how the city will grow and where it will grow, you're probably not going to have a very solid plan. And similarly, if you're just planning for where growth will happen without considering how the city moves, that's also important. So one of the things I'm hoping that we can consider through the city plan is not just, yes, we need to deal with core questions like how do people cross the river? That's absolutely true. And there are creative ideas being discussed in our community right now, including gondolas and everything. So I think that these kinds of conversations will continue. But one of the other things I would add through the city plan is that as we're having conversations with people so far, and I'd love to hear if either of you have feedback on this, one of the assets about our community that folks are noticing is that, or reflecting on, is that it's really a community of communities, and that indeed, if you can start to have the ability to not have to travel great distances to get everything that you need to access during your day, you actually build a more truly accessible city for people because they can live in place. So as we're thinking about building a city for 2 million, my feedback, and then I'll hand it over to you for reflections on this, would be that, yeah, we do need to think about mass transit differently, potentially, and in conjunction with probably some technological opportunities. We'll probably have to consider some physical links, maybe where there are links that could be improved, or links that are just simply missing right now that we'll need to build in the future. And the third thing we should probably be thinking about is how do we reduce the need for everyone to travel so much in the first place? Not that traveling is bad, but you shouldn't have to travel to get everything that you need. So I think through the process of doing this plan, we'll be able to unpack a few of those issues and couple that with some conversations about bridges and links and new tech. And yeah.
Another piece I think linked to that is actually saving our healthcare system, right?
Right.
We know that our healthcare system is busting at the seams. We know that Canadians really want to save that system for our future generations. And, a lot of the conversations around saving the healthcare system is focused on, what efficiencies can you find in the healthcare system, what can you cut, et cetera. There are things to do, of course, in the healthcare system to make it more efficient. But a really key piece that we actually have to think about is how do we actually prevent people from going into the hospital in the first place? How do we actually keep them healthier? And also, once people are sick, like for example, if you get sick with diabetes, right? In order to prevent your complications, you actually have to manage your disease. And often that disease management is not just about taking medications. It's also about making those lifestyle changes, losing some of the weight, getting the physical activity, being able to eat more healthily. And so how we design our communities actually will either support people in preventing these diseases, or even after they get sick, in actually being able to take the measures that they need to take to prevent the complications, or we can only deal with it in the healthcare system. And what we're seeing is that dealing with it only in the healthcare system just isn't working anymore, right? So we need to think about transportation. Are there multiple options, many of which, if it's not the car, you can actually be active, right, doing it. So for example.
And safely.
And safely, absolutely.
Right?
Yeah, absolutely. And what you're talking about, which is like more compact neighborhoods that allow for a sufficient density of people to support a variety of services, right, that are connected by multiple transportation modes, is a really key piece. But so is within the amenities in your neighborhood. Do we have healthy food? Or places that sell healthy food? Or is it just convenience stores and fast food outlets, right? In which case, the studies show if you live around unhealthy food, you eat more unhealthy food and you gain weight. Whereas if people, both adults and children, live around more healthy food, their diets and their weights tend to be healthier. If you have recreation amenities like playgrounds, parks, exercise facilities, then people will exercise more in their leisure time. But they may not always be able to do that. So that active transportation, that walking around, moving around as you get from place to place, can actually be a really important piece of sustaining an active lifestyle and decreasing sedentariness. And then finally, the buildings that we put in our communities too can have a role, right? Like everything from our building codes to our building policies, allowing people to use things like the stairs, et cetera. So I think the additional, system that I would link in is actually the sustainability over time of our healthcare system. And if we don't actually address that, the community design and community planning pieces, including transportation planning, for health and well-being, I don't think we'll be able to sustain the healthcare system over time.
It's interesting. I'll pass it over to Mack, but it's our city council recently approved 4 new goals as part of their vision, and they are healthy city, urban places, climate resilience, and regional prosperity. So as part of the plan, we have to commit to figuring out the best way to make those real in our urban context. And it's neat to see something like healthy city pop into the discourse in such an important way.
Right.
Yes, but yeah.
Just a couple things to add. I agree with you both that building a community that you don't need to leave or travel as far to get to work and play and food and all those sorts of things that you need to do on a daily basis is important. But there's a lot of other factors that go into doing that. So it needs to be affordable to live in that place. So affordable housing is a really big challenge that Council has started to address with the 16% target across the city, which is really interesting. On the bridge itself, I think it's a great question, Chris, because Council doesn't know what to do with the bridge either. We talk about this circulator LRT, and there's a big gap, which is where the river is, and how do we cross the river? We're not sure yet how we're going to cross the river. We know that people need to get across the river somehow, but the way to do that, maybe it's not the high-level bridge. It's had a number of different roles in its long lifespan. Maybe we need another bridge. There's already quite a few in that little chunk of space, though, of the river, so that's a consideration that we need to think about as well. And there's other potential uses for the high level that could support some of what you're talking about. There's a group called High Level Line that is pushing, inspired by the High Line in New York and all of the positive impacts that had. Could we do that with the high level bridge and allow people to walk across there or bike across there, use more active modes of transportation to get across, such a historic part of our city? Like, it's not going to go anywhere. It's way too important to, how Edmonton came to be to tear it down or anything like that. So how do we ensure that there's a functional use for it going forward?
Yeah. Yeah.
That's great. We have, I'll do the little time check thing where I let folks know who might just be joining what we're doing here today. We are hosting a Facebook Live conversation about our new city plan. And with me I have Mack Male and Dr. Karen Lee. We have another question from Facebook. This is from Wasim. What kind of jobs is Edmonton targeting with its new city plan or its new plan? So off the top, I would say I don't think that there's any specific industry that's being targeted at this stage. This is where I think the physical building of a city and larger strategies like economic development kind of roles within cities and city regions need to start to come together. But I would reflect that the economy seems to be rapidly diversifying in a new way. So people are working in very different ways. They're working in new industries. And our city has a pretty, well, what would I say here? I'd say that the future of the world seems to be urban, is I think a fair point to make, and that if we want to be participating in that urban world, we need to think about how we're going to be attracting and retaining talent and making sure that Edmonton's the kind of place that isn't just a place for jobs, but a place people want to stay and live their full lives. But in terms of what types of jobs are we going to be thinking about, I have nothing specific to add right yet.
I mean, I'll throw out one that I think we need to.
Yeah.
Lots of people are talking about artificial intelligence and machine learning and these types of things as part of this, fourth industrial revolution that we're, in the midst of right now. And Edmonton has one of the world leading facilities on artificial intelligence research right here at the University of Alberta, and that's AMI, the Alberta Machine Intelligence Institute. It's kind of like finding oil at Leduc, 60, 70 years ago. That's how important it could be to Edmonton. So I'm not saying that all of our future jobs in Edmonton need to be in artificial intelligence and in machine learning, but the kinds of impacts that those technologies are going to have on the economy and on the types of work that we all do, I think we need to be thinking about now. And absolutely, there's an opportunity for our city to capitalize on all of the great stuff that we've got here. We have amazing post-secondary schools. We have a world-leading education system. It is affordable to live in Edmonton compared to many other places. How can we build on that to really make the most of this opportunity that we have? It's a little bit of luck and a little bit of planning and a little bit of, foresight that led to this confluence of events that led to what we've got here in Edmonton. So we need to make sure that we don't let that opportunity pass us by. So I don't know, what the jobs of the future might look like any more than you guys do, but I do know that artificial intelligence is going to be a real critical part of, the economy everywhere, and Edmonton has a real opportunity there.
Yeah.
I wanted to touch on how I think some of the topics we've talked about, like transportation infrastructure and healthy food amenities and stuff, and how that can actually also link to economic development.
Okay.
So I've already mentioned, right, and about jobs too.
Right.
So I've already mentioned, the importance of creating better designed neighborhoods and streets, because not only can they promote active lifestyles and promote people being able to walk and bicycle. And transit involves usually some walking as
Right.
well. And those are good for health. But they actually can also, the way we design our communities can also either create more jobs through the infrastructure that we're building or less jobs. So I'll give you an example. There was actually a study down in the US that actually looked at how many jobs you could create by the types of communities you were building. So if you build a really sprawled community where land costs are huge, and because it's so sprawled, you have to actually put in way more equipment and infrastructure, you would spend a lot more money on that land and infrastructure as opposed to labor. Whereas if you create a more compact community where you actually put in also bike lanes, sidewalks, transit, for every dollar that you spend on that road, or every $1 million, you would actually create more jobs in that compact community that had complete streets compared to the sprawled community where a lot more of your money went to land costs and equipment costs and stuff.
Right, just like a return on investment.
Yeah, so if creating jobs is actually a priority for us, which it is in many communities, right?
Every economy needs
in every
to create
economy,
jobs.
exactly.
Yeah.
So basically, if that's a priority for us, then creating more compact communities with complete streets can actually help us to achieve more jobs than creating sprawled communities where we're dispersing that money instead of into labor, into like land and physical materials. The other is, when I was in New York, one of the things that we did was the health department worked closely with economic development and with planning on a program and initiative called FRESH, Food Retail Expansion to Support Health. And what we did was we mapped our neighborhoods that had the highest obesity and diabetes rates. And we worked with city planning, and they brought their data from New York State Agriculture and Markets. And we were able to basically overlay the maps of where supermarkets were completely lacking or very lacking, and where our high rates of poor health were. And then, of course, those were often also some of our food deserts were often our poorest neighborhoods that also needed jobs. And so economic development, health, and planning worked together to create this new initiative called FRESH, where we looked at, for those neighborhoods, were there zoning and tax incentives that the city could create working with, for example, the state. So economic development was able to get New York State to basically say, hey, we're not going to, we will remove the sales tax on materials if you're building a supermarket in a high needs neighborhood that's a food desert also, right? So those are just some examples. Zoning looked at things like, in some of the inner city neighborhoods, do we need to define a supermarket as a 40,000 square foot store with like C's and C's of parking? No, we don't, right? And so city planning actually ended up redefining a supermarket as a smaller square footage store because these neighborhoods didn't have a lot of parking space. It was redefined how much parking was required for these smaller stores. And through that, basically a large number of supermarkets were created, and they created then access to healthy foods like fruits and vegetables. There was defined areas for fresh food like fruits and vegetables that if you're taking those incentives, you need it to do. And then they're also creating jobs, right, in those neighborhoods. And so I think that we can find these win-win solutions by learning from other jurisdictions, but also from some of the studies that are now coming out, showing that we can do multiple things and get multiple benefits at once.
Right.
Yeah.
No, it's a great thought. Yeah, we've coming from a way of planning cities, not just in Edmonton, but everywhere, since the end of the Second World War, where there was a place for everything and everything in its place. And there are some downsides to that. Sometimes spaces can be more multifunctional. They can do more than one thing at a time. Glad you brought up neighborhoods in need, because we haven't talked about that yet, and we have a question. It's not exactly to this point, but it is about affordability, and I think that this is an interesting one for us to tackle. This is from Mustafa. We need to get more affordable rental properties for the middle class. How will the city plan address that? Do you have any thoughts on this, Mack?
Well, I have some thoughts on how I'd like it to address
Sure,
that, I suppose,
yeah.
right? I mean,
Go for it.
I think one of the great things about a city is choice and the ability to choose where you live and the type of house you're going to live in, the type of community you want to live in. And I think the city plan can help encourage more choice for Edmontonians through the types of restrictions and the types of incentives and things like that that are included in the plan and in the, you know, the implementation of that plan. So I think that's one of the real critical things, is there needs to be greater choice. You know, at the moment it feels a little bit sometimes like either there's a high-rise condo or apartment, or there's a single detached home somewhere off on a lot. And there's not a lot in the middle. And I know that, you know, with Blatchford and some of the other projects that are ongoing in the city, there's some opportunity to try to address that variety of housing type. But that's certainly something I'd like to see really strongly reflected in the city plan, to make sure that there is those opportunities, and, you know, both for ownership and for rental, and you get a bit of rental when you've got people owning those facilities as well. So I think that's an important part. Again, I think affordable housing is really critical, and it's not just something the City of Edmonton needs to address. We certainly need some support from the other orders of government in tackling that problem, but it needs to be possible to have that choice and to be able to choose a community, and not have it be not a choice or not an option for you simply because it's too expensive. So kind of spreading the affordability of housing around the city, I think, is really critical.
Yeah, I think, you know, a mix of housing types in different neighborhoods is really important.
Yeah.
Because, you know, the reality is that, you know, even for people who have been living in a neighborhood that has primarily single-family homes, we know that in many of our neighborhoods, people are aging.
Right.
And so at some point, you know, you may not be able to live or sustain yourself in that single-family home. But does that mean then that you have to leave your neighborhood and go to somewhere where all of your networks are located in that neighborhood, right? And so if there were other options, like higher density options, like condos, apartments, etc.
Townhomes, things.
Townhomes, yeah. So a variety of types of housing, then it actually allows you to be able to remain in your neighborhood and connect it to you know, your neighbors and people you know and the community you know. So I think, you know, thinking about how do we provide as many options as is possible in as many neighborhoods as is possible, I think it's a really important one. The other is, when we think about affordable housing, I think we often think affordable housing is like low-income housing.
Yeah.
But in fact, we should
Broader.
be thinking, it's much broader than that, right? And there are jurisdictions increasingly now that are thinking about affordability in a whole spectrum, right? And I think many people don't know this, right? But one of the places cited as like the bastion of capitalism is Singapore, right? But did you know that in Singapore, something like over 80% of Singapore's population actually lives in housing that's in some way subsidized by the government? Yeah. And so because the government has created a spectrum of housing, of housing that actually addresses needs at different income levels, right? All the way up to the middle class. And so I think, you know, the new way of thinking about affordable housing in many communities and many jurisdictions is mixed income housing.
Yep.
Like affordable housing is not just housing for, you know, that meets the highest needs, but that actually meets the needs in various spectrum of incomes. So I think there's an opportunity for us to do that. And I would add that when we're developing housing, there are great opportunities for us to think about, like, how are we siting that housing, right? Because that can actually affect affordability issues. Like, if you're siting housing that's more affordable, but it's, you know, located way out and there's no transportation systems except for the car, then you probably have to buy multiple cars for your family, and those are expensive to maintain, right? So siting issues, what amenities are around that? Can you get healthy food around it? Can you get recreation areas? I see there's a recreation question as well. And then also within your building, if it's a higher density multi-unit building, within your building or your development, do you have healthy amenities, right? You know, does it have spaces for active play for children, for adults? Which are often also green spaces that are good for mental health, right? So yeah.
I like the idea of aging in place doesn't mean necessarily you have to be in the same physical structure as you age, right? And the ability to stay in your community that you have these connections and networks in a different type of house would be really, really interesting. Last thing, I have a young daughter, growing family. We need to make sure we're building more bedrooms in some of these units that are available for rent and, you know, in these other types of housing, because not everybody wants to live out in the suburbs in a single family home, and so you need to be able to have enough bedrooms in an apartment or in a townhome to support growing families. So that's another thing that I'd like to see.
And even for young people, right? Like, for example, after college, you know, when you come back to, if you go away or you're living elsewhere, you may want to go back to the community you grew up in. But if there's only single family homes, especially with the price of homes now, you can't necessarily like purchase one of those homes.
That's not a starting out.
That's not starting out. Yeah. And so then you can't actually return to the community that you want to return to, because the housing options of, like, maybe you want to rent an apartment for now. Maybe you want to, you can only afford to buy a condo for now. If they're not there in the community you grew up in, then you will have to wait a while before returning to that community.
We have about only 10 minutes left.
Oh, okay.
It's amazing, hey? We've buzzed through. So we will take the last, maybe a couple, we'll try to be fast in our answers. If there's any more questions, and we'll give you some wrap-up thoughts. The question of affordability is really interesting. I went to, there was Paths for People hosted kind of an event in the spring, and Janet Sedekon was there, and she said something that was really, really stuck with me. She said a lot of things that stuck with me, but one of them was just remember that we're all temporarily able. Yes. We're not, you know, it's very, very, and so I think the same thing applies to housing. Yes. We don't have the same needs over our life cycle, and so we have to, even if we're not thinking about what our other fellow community members might want or need, even if it's a very selfish thought, what will I need? Whether it's in 5 years or 10 or 20 or 40 or whatever that cycle is, but it's not going to be the same thing.
Yeah.
All right, let's get to another question. This one is from Teresa. How will the city incorporate recreation into the city plan? Do either of you have any thoughts about recreation, what we need to think about, preserve, maybe what we've got, or add on to if we need something new?
Well, whenever I think about how a city or a neighborhood or a community can improve health, particularly in the current context, right, of the epidemics of diabetes, heart disease and strokes, cancers, that share these risk factors of, physical inactivity, unhealthy diets, sedentary lifestyles. We've talked about also tobacco smoke, but that's, we've addressed that to a much larger degree. I think about like 4 areas, right, that we can really focus on. And also mental health issues, I think, as you mentioned, Mack, because, even though mental health issues like depression and anxiety are not major causes of death, they are major causes of disability, of healthcare utilization as well. But anyways, I think about 4 realms. Like, I think about, do we have healthy and active transportation options? Do we have healthy and active recreation options? Do we have healthy foods and beverages that we can access and amenities that provide them in our communities and neighborhoods? And finally, do we have healthy and active buildings? And
how can we make that work for seniors? We got a question from Dennis that not everybody's a bike riding, able-bodied walker. How can we think through building an inclusive city for people who aren't about to jump on their bike and ride to their local grocery store?
Also, though, I think the case of places like Copenhagen shows us that if we have safe bicycle infrastructure, actually people can bicycle at, younger ages and older ages, right? So if you were capable,
right,
but you needed a more safe infrastructure to do that, then providing that would actually allow people to do that for a longer period of time, right? But I think that's where also the walkability piece comes in, right? Because if you have amenities like the grocery store, like a park near where you live, then even when you stop driving and have to stop driving, and all of us at some point will be impacted by disabilities, as you said, it's a matter of our aging, right? Then you can still live in that neighborhood and you can still go about your life and maybe go visit your neighbor, etc.
Yeah, I mean, I think the River Valley and our green space in Edmonton is instructive for, you know, a number of these things, recreation centers being one of them. We have the largest urban park. People talk about that all the time, but that's not enough. We need more green space. You can never have too much green space. And accessibility into the River Valley can be a real challenge for some people. And that's why it's so great to have smaller, you know, neighborhood-based green space that's more easily accessible, that still has good amenities. It does contribute to those health factors, as you say. It contributes to that connectedness with your community. You run into your neighbors, and you know, things happen in a green space like that that don't happen elsewhere. So, you know, as we're building recreation centers and we're building these really massive recreation centers, it's kind of at odds with that idea that you've got this neighborhood-based access to recreation and to other amenities. So I think that's something the city plan is going to have to address in some way. It might be more efficient to operate a really large mega recreation center somewhere, but it might not actually give us the right return on investment if we start to consider more than just what does it cost in terms of dollars to operate, what does it cost in terms of connectivity and healthy lifestyles and things like that. So, you know, I think that also impacts seniors issues and family issues. You know, those are sometimes the same in terms of accessibility. Maybe you can't cycle, or maybe you can't walk very far, or maybe you have a stroller or something like that. So if you're not forced to go really far to get access to these amenities, that makes a really big difference to your quality of life. So having these neighborhood-based things really makes a difference. Where I live right downtown, we now have the new Alex Dakota Park, and it's really made a difference for the community because it's right there.
Yeah, and the socialization and community connectedness too. Yeah, I mean, studies show that, you know, if amenities that are within about 5 to 10 minute walk of people's homes, they will tend to walk to. Right. If it's much further than that, then possibly not. And I also wanted to mention, you know, a few years ago I was involved actually with the U of A in a study that we did in Taipei. And, you know, it was really interesting because in Taipei, every little pocket park that they had, they would not only have just benches, for example, but they would try to incorporate in like active play stuff for kids.
Oh, I love the exercise equipment.
Yeah, and the exercise equipment right next to it, right? So that parents, for grown-ups, so that, you know, parents often say they don't have enough time to exercise because between their kids and their job, et cetera. And so what we want to do is to allow parents to be able to do it, like to use that exercise equipment, right, when their kids are playing, and then they're also modeling great behaviors for the kids, right? And then that coupled with hopefully things like, you know, there are opportunities to walk to a few things. So if you did that daily, you're getting in another like 20, 30 minutes, right?
Well, thank you. I'm getting a cue that I need to start moving towards closing us up. We have just a few minutes left. We'll be hosting a lot of different engagement sessions around the city in person over the next couple of months. So we have we can probably put a link to that on our Facebook page, and I think also we can connect to Taproot and to your website, Dr. Lee, because you have a lot of interesting resources on it. So we will be out and about in the community. We will also be continuing to experiment with online engagements. So let us know how you think this went, or if you have any recommendations for how we could do better, or if you want to see this again, or if you're like, please never do that again, that's fine too. Yeah, so I'll just let you know that, everything's on the website in terms of where we'll physically be, and then we're being just a little bit more nimble with the social media, and we're trying to find opportunities where we can. So I think, what do we have, like 5 minutes left? 0 minutes? 0 minutes.
Zero.
We don't even
went
get to
by quickly.
All right. I do want to thank Mack Male and Dr. Karen Lee for being on our very first Facebook Live and for sitting in conversation with me and with you about the new city plan. Thank you very much.
Thank you.
Thanks.